Hello, I'm Dr. Patience White, Co-Director of GOT Transition Center for Healthcare Transition Improvement and Professor of Pediatrics and Medicine at George Washington University School of Medicine and Health Sciences in Washington, D.C. GOT Transition is happy to bring you this MOC module, How to Improve the Transition from Pediatric to Adult Healthcare, a New Strategy. This is part of a series of MOC modules for the American Board of Pediatrics. I have no disclosures. What is pediatric to adult healthcare transition? It's moving seamlessly from pediatric to adult focused systems and includes several components listed on this slide. Today, though, we are going to focus on preparation for and transfer to adult healthcare. Healthcare transition goals are to improve the ability of youth and young adults to manage their own health and health services, to ensure an organized clinical process in pediatric and adult practices to facilitate transition. There are estimated 18 million adolescents in the U.S. ages 18 to 21, a quarter of whom have chronic conditions. The majority of youth and families are ill-prepared to transition to adult-centered care. Without transition services, research has shown health is diminished, quality of care is compromised, and costs are increased. Surveys of healthcare providers show they lack a systematic way to support youth and families in transition from pediatric to adult healthcare. As you can see from this graph, care utilization changes during transition years. For those ages 18 to 21, there is a decrease in usual source of care, markedly less preventive care visits, and increased utilization of emergency rooms. There are several organizations, such as the ACA, NCQA, Healthy People 2020, Federal Maternal and Child Health Bureau, CMS, and CMMI, who are involved in transition in a variety of ways. So there's lots of transition fervor going fast down these tracks. But the state of healthcare transition from pediatric to adult healthcare is just in its beginning stages. So what to do? Where should I start? The goals of GOT Transition Center for Healthcare Transition Improvement, which is funded by the Federal Maternal and Child Health Bureau, are dissemination of quality improvement to practices and larger populations around transition, transition education and training, young adult and family engagement, transition quality, policy interventions, and transition information dissemination. This shows you a picture of our website where you'll be able to find examples of all the tools I'll be discussing in this module. You can see there's an area for healthcare providers, youth and families, policy makers, and researchers. Much of the transition work is based on the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Physicians clinical report on healthcare transition. It was published in 2011, targets all youth beginning at age 12, has an algorithmic structure with branching components for youth with special healthcare needs. It can be applied to both primary and specialty practices. It extends through transfer and establishment of care to an adult medical home and adult specialists. The clinical report was recently renewed by the AAP, and the 3 professional societies will update this clinical report in 2017. The 6 core elements of healthcare transition are built on the clinical report. It's a nationally recognized transition model and consists of these 6 steps: transition policy, transition tracking and monitoring, transition readiness, transition planning, transfer integration into adult-centered care, transition completion, and ongoing care. And you can see how they associate with the age. This is beginning between ages 12 and 14 through ages 18 through 26. This shows you there are a lot of sample forms and templates available for each of the 6 core elements on gottransition.org. The 6 core elements are available in 3 transition packages for practices for different transition situations around pediatric adult healthcare. Going to an adult healthcare provider, transitioning to an adult approach to care without changing the provider, and integrating into an adult healthcare practice. The 6 core elements tools are aligned with the clinical report, have been updated and released in June of 2014, are available free on gottransition.org, are customizable and available in Spanish. Now we're going to turn and look at one of these packages, Transitioning Youth to Adult Healthcare Providers. Core element number 1 is transition policy. Examples of transition policies are available at gottransition.org. In general, a transition policy should emphasize an adult approach to care and legal changes at age 18, include clarity about support offered by the practice and the ages that the process begins and there is the expectation for transfer, be posted for all to see starting at age 12 and throughout adolescence. This core element was particularly welcomed by providers, families, and youth involved in the creation of these tools. It builds consensus, allows for planning, and everybody understands what is expected and about confidentiality and consent. Core element number 2 is around tracking and monitoring. Tracking and monitoring includes tools available for practices with and without electronic records so that the practice can track their patient's receipt of the 6 core elements. There's an individual transition flow sheet or an Excel file for use in paper charts or can be incorporated to an electronic health record. Core element number 3, transition readiness. Transition readiness assessment's goal is to assess readiness for an adult approach to care beginning at age 14 for both youth and parents and guardians. It's billable under 99420. It should be repeated periodically as part of a routine preventive care, and it helps develop a plan to teach identified readiness skills needed. Here's an example of a transition readiness assessment from Got Transition. It includes validated questions on importance and confidence, and assessment of self-care skills. It can be customized for youth with special health care needs, as has been done by the American College of Physicians Council on Subspecialty Societies, which their tools will be available at their website in May of 2016. The youth and families appreciated learning what skills were needed for being successful in adult approach to care, and providers appreciated learning how best to focus self-care education when they used this transition readiness assessment. Core element number 4, transition planning. Most practices have a plan of care template, but if not, there's one available at gottransition.org and it incorporates health into the youth overall priorities. You can integrate the self-care skills identified in the readiness assessment into the plan of care. Transition planning should also include developing combined medical summary and emergency care plan. Templates are available at gottransition.org, and address issues of supported decision-making before the age of 18, if needed. Additional areas of transition planning include discussing the youth's preferences for their future adult provider, creating a list of adult providers who your practice has learned are interested in caring for young adults, and if possible, sharing the Got Transition approach and package for adult providers with them, and obtaining and sharing the adult practice's policy and office welcome and orientation materials with your transitioning youth. If needed, develop or locate a condition fact sheet on the pediatric onset illness of your transitioning youth to assist the adult practice, as they might have received little training in some of these diseases. The 5th core element is transfer of care. Transfer of care is a key time to have clear communication between the pediatric and adult practice. The pediatric practice should send a transfer letter to the adult provider with the appropriate documentation as listed on the right of this slide. It also should include a statement that the youth's care is covered by the pediatric practice until the first adult visit, and offer to be a consultant to the adult provider. Many of the adult providers need your help in understanding the complex needs of some of the youth with special health care needs and establishing a long-term relationship with your youth transitioning to their practice. Your support is key. The sixth core element is transfer completion. Transfer completion has two components. First, it's important that the practice check with the adult provider that your young adult actually has shown up for their initial visit. And secondly, it's a great time to get feedback on the transition processes that you develop. There's an example on the right side of this slide of a transition feedback survey that youth can fill out and send back to you. This is available and can be customized at transition.org. There are two practice measurement options if you so choose to look at them. The first is a qualitative self-assessment tool modeled after the Medical Home Index. It provides a snapshot of where the practice is in implementing transition processes. This is a good tool to use at the beginning of any quality improvement efforts that you embark upon. You can see the example here. You would circle whether you are level 1, 2, 3, or 4. And when you look closely, level 1 would be the clinicians vary in their approach to healthcare transition, including appropriate age for transfer, up to level 4, which shows that you would have a written transition policy with input from youth and families, include practice approaches with expected ages range for transfer. It would be shared with all beginning at the age of 12 to 14. The second measurement option is an objective scoring method with documentation requirements. This is an example of this measurement tool, and you can see that under each component of transition policy, you would rate yourself and get a score whether you did or did not have this. In this MOC module, there are methods of improving quality, such as self-evaluation and reporting, identification of benchmarks and standards, and there's additional training and education. The next steps are completing the MOC quality improvement activity focused on transition, evaluating documentation of essential elements of transition preparation and performance, completing 10 patient-centered data reports at each data collection point, completing one office data report. The format includes PowerPoint slide presentations with accompanying audio, knowledge assessment, data collection at 3 time points, feedback, and quality improvement. In summary, healthcare transition is a time of decreased health and quality of care and increased costs for youth and young adults moving to adult health care. Pediatric and adult practices vary in their approach to this important transition. Improving the practice's transition process is a key step in improving transition for their patients with and without special healthcare needs. The 6 core elements with accompanying tools offers evidence-informed approach to improve transition from pediatric to adult healthcare. I would like to thank the providers, families, youth, and GOT transition staff who together developed the 6 core element approach and tools. The Clinical and Translational Research Institute at the University of California, San Diego, especially the laboratory of Dr. Jeannie Huang, and the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. I thank you for your attention, and please go to gottransition.org for all the tools that were discussed during this presentation.